How to treat uterine fibroids and heavy bleeding naturally. This is a big topic. It's estimated between 50 and 70% of women will at some point have a fibroid. Well, today I'm doing a paraphrase of an interview between Dr. John R. Lee and Dr. Carolyn DeMarco, a women's health expert. The questions are from Dr. Lee and the answers are from Dr. Carolyn DeMarco. What is a fibroid? Fibroids are benign tumors of the uterus. Benign. They are made of smooth muscle and fibrous tissue. They can be located either inside or outside the uterus. Estrogen dominance is the main cause of uterine fibroids. What are the symptoms? Not all fibroids have symptoms, but when they do, they could include heavy bleeding, pelvic pressure, and urinary frequency. Fibroids can cause infertility and miscarriage. How are they best treated? With no symptoms, a wait-and-see approach is best because fibroids will shrink at menopause. Now, many doctors will recommend a hysterectomy. Fibroids cause 1/3 of all hysterectomies. It's much simpler for the doctor to take out the uterus than to simply try to take out the fibroid. Simple for the doctor and complicated for the woman? Dr. DeMarco says yes. The surgical complication rate for an ordinary hysterectomy is high, 40 to 50%, and it's a 6-week recuperation period at least. It's a complicated major surgery with a long recovery time. I'm fundamentally opposed to taking out the uterus unless there's a much more serious problem. Now, often a surgeon will take out the ovaries as well, and that causes instant menopause. Even if your ovaries are left, they will usually shut down within 2 to 5 years of the hysterectomy. The vast majority of hysterectomies are done between the ages of 20 and 49. That's an early age to go into menopause. If the ovaries are removed and stop functioning, you will lose 50% of your testosterone, and many women will totally lose their sex drive as a result. Dr. Lee, can a woman with fibroids as small as 1 to 2 inches have symptoms? Yes, depending on where they are located. Fibroids located in the wall of the uterus can cause quite a bit of bleeding. Is that one of the primary causes of heavy bleeding? Yes, along with estrogen excess in general. Perimenopause is a time when many women have heavy bleeding and it's debilitating. It makes you feel panic-stricken. So when your doctor says, oh, let's just yank it all out, that'll solve your problems, it's an almost irresistible offer. But it doesn't solve your problems at all if you're estrogen dominant. Dr. Lee, how do you treat heavy bleeding, Dr. DeMarco? She answers, natural progesterone is often very helpful in bringing the system back into balance. I also recommend high doses of bioflavonoids, over 1,000 milligrams a day, especially quercetin and rutin. These strengthen capillaries in the uterus. How do you treat fibroids in your patients? Here's Dr. DeMarco's answer. I decrease the estrogen overload with progesterone and DIM. I support liver function to get rid of excess estrogens. The best supplement is Milk Thistle. Increase pelvic circulation. Vitex, also known as chasteberry, is very good for this. And finally, but probably firstly, natural progesterone cream, a key component to treating a fibroid. I put every fibroid patient on progesterone cream, applying day 12 to 26 of the cycle, 1/4 to 1/2 teaspoon per day, twice per day. And you can actually start on day 10 or day 8 if your bleeding is exceptionally heavy. Okay, friends, there you go. You can try these protocols before having a hysterectomy. You've got nothing to lose, and you can save your uterus. And if you need this in written form, it's all on my blog, which is at hopeforyourhormones.com. Thanks for watching.